Hi, I'm Dr. Daniel Tofik, an instructor in pediatric critical care medicine at the Stanford University School of Medicine. I and my co-authors are pleased to present our study titled Physician Burnout, Well-Being, and Work Unit Safety Grades in relation to reported medical errors appearing in Mayo Clinic Proceedings. The key takeaway point from this study is that both individual physician burnout and work unit safety grades are strongly associated with medical errors, suggesting that attempts at medical error prevention should address both of these aspects in order to maximize their effectiveness. Medical errors are common in the United States healthcare system and represent a major source of inpatient deaths. Safety grades provide a summary reflection of the patient safety practices within a work unit intended to reduce these errors. However, the relationship between safety grades and patient outcomes is not well understood, and the influence of physician well-being on this relationship is unknown. In order to address this gap, we conducted a cross-sectional survey of several thousand physicians in active practice in the United States, representing all specialties. This survey included assessments of burnout and well-being, a safety grade for their primary work area, and the question, are you concerned you have made any major medical errors in the last 3 months? Burnout was found in over half of the physicians sampled, and low work unit safety grade was reported by 1/5. 1/10 reported a recent major medical error, with many of these errors resulting in major permanent morbidity or death. We found meaningful and statistically significant associations for each aspect of physician well-being evaluated in this study. Low quality of life, fatigue, depressive symptoms, and suicidal ideation all strongly associated with increased medical errors. We also found errors to associate both with physician burnout and with work unit safety grades, as shown in this figure. Physicians with burnout, represented in the dark bars, had higher prevalence of errors across the sample, as compared to their colleagues without burnout, represented in the light bars. Additionally, we discovered a consistent increase in errors in both groups when comparing those in work units with excellent safety grades on the left to those with failing safety grades on the right. Burnout and work unit safety grades maintained these independent relationships with errors in multivariable modeling after adjustment for gender, age, specialty, work hours, and fatigue. It should also be noted that the increased odds of errors associated not only with categorization into burned out versus not burned out as described here, but even with single-point changes in burnout scales. These findings have 3 main implications. First, medical errors strongly associated with depression and suicidality. This highlights the importance of addressing physician mental health with implications both for the physicians themselves and for their patients. Second, burnout scores associated with errors all along the burnout scales. This suggests that merely categorizing physicians as burned out or not may ignore important relationships that exist all along the burnout continuum. And finally, medical errors exhibited independent relationships both with physician burnout and with work unit safety grades. This suggests that a combination of physician-targeted burnout interventions and unit-targeted patient safety improvement measures is needed in order to provide the most effective error prevention.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.